I present to you an animated but informative video on the topic COVID-19.
There's no need to worry, you are negative. Thank you, doctor, but I would like to know more about this coronavirus. Could you please help me? Yes, why not? Let me provide some basic information about this virus to you. Okay, so listen carefully. The COVID-19 or coronavirus spreads primarily through droplets of saliva or discharge from the nose when an infected person coughs or sneezes. So it's important that you also practice respiratory etiquette, for example, by coughing into a flexed elbow, and also make sure that you wear a mask. So doctor, does that mean that the coronavirus or COVID-19 is spread by direct contact? Yes, that does mean that the coronavirus is spread by direct contact. Then how can we prevent this? To prevent the spread of COVID-19, clean your hands often, use soap and water or an alcohol-based hand rub, maintain a safe distance from anyone who is coughing or sneezing, wear a mask when physical distancing is not possible, do not touch your eyes, nose or mouth, cover your nose and mouth with your bent elbow or a tissue when you cough or sneeze. Stay home if you feel unwell. If you have a fever, cough and difficulty breathing, seek immediate medical attention. If a person has coronavirus, what can that person do? First of all, make sure that the person does not panic, because most people infected with the COVID-19 virus will experience mild to moderate respiratory illness and recover without requiring special treatment. And what if older people and those with underlying medical problems like cardiovascular disease, diabetes, chronic respiratory disease and cancer, are they more likely to develop serious illness? Yes, if not treated properly, they are more likely to develop serious illness. Doctor, what are the symptoms for coronavirus? Oh yes, this is a good question. Okay, so listen carefully. The most common symptoms that people experience are fever, dry cough and tiredness. And then there comes the less common symptoms, which are aches and pains, sore throat, diarrhea, conjunctivitis, headache, loss of taste or smell, a rash on skin or discoloration of fingers or toes. And then comes the serious symptoms, which are difficulty in breathing or shortness of breath, chest pain or pressure, loss of speech or movement. And anyone who experiences serious symptoms should immediately seek medical attention. And also always call before visiting your doctor or health facility. The people with mild symptoms who are otherwise healthy, are they more likely to manage their symptoms at home? Yes, people with mild symptoms who are otherwise healthy should be able to manage their symptoms at home. How many days does it take for the coronavirus symptoms to show? Okay, on average it takes around 5 to 6 days from when someone is infected with the virus for symptoms to show. However, it can take up to 14 days. What is the normal oxygen level in an average person? Okay, so now the average oxygen level in a person is above 94, and if it drops below 94, then there is a chance for it to drop even lower, and if not treated immediately, it can even lead to death. Doctor, there's a news, or rather a saying, that if you get vaccinated by the COVID vaccine, you're more likely to develop COVID itself within 14 days. So is it true or just a rumor? Okay, so this is just a rumor. Even though the body's immunity is weak till 14 to 28 days after being vaccinated, but still it does not mean that you can develop COVID itself after getting vaccinated. And doctor, can you get COVID after being vaccinated? Yes, you can get COVID after being vaccinated. But there are 0.01 chances of death from COVID after getting vaccinated.
If you like the video, then make sure to smash the like button and also hit the subscribe button to never miss an update.